Good morning and welcome to the Senate Committee on Education and Health. Today we have 46 bills on the docket. I'm going to start by reminding everyone how we will operate, but before I do that, I want to ask the clerk to call the roll.
Hey, George.
Madam Chair, you have a quorum.
Thank you. Thank you so much, sir. First, we will address two bills that will be directly re-referred to other committees. Next, each of our subcommittee chairs will give a report. Every bill that went through a subcommittee had the opportunity for public testimony, and we will not hear additional public testimony. We will only hear from patrons on these bills if it is necessary. If your bill received a unanimous positive recommendation from a subcommittee, you do not need to remain here. We will call on you if your bill hits a roadblock. We will then move on to the 5 bills on our docket that will be heard for the first time. These bills, 5 minutes of public testimony will be permitted for each side. At the top of our docket, we have bills recommended for referral. And the first one is going to be Senate Bill 1225. The patriot is Senator Obenshane, and that bill will be re-referred to Judiciary.
So moved.
It's been moved and properly second that the bill will be re-referred to Judiciary. All in favor, is this going to be a recorded vote? Yes. Please record on the electronic voting board.
Ayes 14, no zero.
Ayes 14, no zero. The bill is re-referred to Judiciary. The next bill to be re-referred is Senate Bill 1164, and 1164 will be re-referred to Senate Finance. May I have a motion? It's been moved and properly second that the bill be re-referred to Senate Finance. All in favor or not, please record your positions.
Ayes 14, no zero.
Ayes 14, no zero. The bill will be re-referred. The next bill to be re-referred is Senate Bill 1279, and its patron is Senator Boysko. The bill will be re-referred to General Laws. May I please have a motion? It's been moved and properly second that the bill be re-referred to General Laws. All in favor, vote on the electronic voting block.
Ayes 13, no zero.
Ayes 13, no zero. The bill will be re-referred to General Laws. Now, as I indicated when I opened up, we are now going to go to the subcommittee chairs, and the first subcommittee chair will be Senator Barker, and it's for Subcommittee on Health Professions. Senator Barker?
All right, we have about eight or nine bills here that we handled in the Health Professions Subcommittee, and we did reach recommendations on all of these. So we'll start with Senate Bill 793. It's prescriptions for hydroxychloroquine and ivermectin for treatment. There was a motion to report, and that failed on a 2 yes and 5 no vote. And so I will offer a motion to be able to for pass by indefinitely.
You've heard the motion?
Yeah.
It's been moved and properly second that Senate Bill 793 be passed by indefinitely.
Madam Chairman,
Sen-
just to speak.
Senator Donovan?
Just to speak to that motion for 1 second. This bill is really about prescribing off-label and not having the government limit doctors. They already have that ability. If we start Christmas treeing what people can and can't prescribe for, we're making a real mistake in the practice of medicine. And so just be clear, this is not about those 2 medications. This is about prescribing off-label.
Thank you, Senator Donovan. The bill has received testimony. We will not receive any more. The motion is on the floor. All in favor, please designate. The recommendation is passed by indefinitely.
Ayes 8, no 6.
Ayes 8, no 6. The bill will be passed by indefinitely. Senator Barker.
All right, next is Senate Bill 948 from Senator Suderline. And this deals with the pharmacist scope of practice and initiation of treatment for certain diseases and conditions. And we recommend reporting with an amendment and on a vote of 7-0 with one abstention.
Madam Chairman,
Senator Donovan?
I'm not sure if the amendment that Senator Barker refers to is the amendment that I'm proposing now, but we have not agreed to that amendment yet, and I do have one.
All right.
Senator
So
Barker,
it-
do you want to pass by it temporarily?
Yeah,
No.
I'll pass by
Oh,
temporarily.
I'm sorry.
Yeah.
Second? Oh,
we had-
okay, clerk has
she
it
has it
ready.
ready.
All right.
Okay.
Could you please distribute the amendment? Thank you. Thank you. Senator Donovan, you want to address the amendment?
Yes, ma'am. Thank you, Madam Chairman. I am very passionate that we are able to make things easier for patients in Virginia. And as a result, I really thought we were doing the right thing on line 16 by referencing Code Section 54.1-2969. And I was way too convinced that was the right thing to do, only to have found out since it's not only not needed, because right now pharmacists with the right directions from a physician can inject medications for the patient, but it actually causes unintended consequences of allowing pharmacists to be able to initiate to minors birth control without seeing a doctor. So I definitely don't want that to happen, so we're striking that line, and there's no reference, and that cleans up the bill. And I think with that, we have peace in the valley on the bill, Madam Chairman.
Thank you, Senator Donovan. Senator Barker?
All right, well, I guess then we'll consider, once the...
It's been moved, and there's a second to agree to the amendment. All in favor, say aye.
Aye.
Senator Barker?
All right, with that amendment, then I recommend reporting and would ask to have us vote on that motion, so.
It's been moved and properly second that the bill be reported. All in favor, please designate electronically.
Ayes 14, no zero.
Ayes 14, no zero, the bill will be reported. Senator Barker?
All right, and then the next bill we have is Senate Bill 975 from Senator Peake. It was recommended for reporting with an amendment on a vote of 8-0, and it deals with the certified nurse midwives, certified registered nurse anesthetists, clinical nurse specialists, and nurse practitioners, and that we would be designated them as advanced practice registered nurses. And with that, then I'll move the committee amendment. All right.
There's a motion and a second to agree with the amendment. All in favor, please designate, please say aye.
Aye.
Thank you. Senator Barker?
All right, and with that amendment, I will make a motion that the bill be reported.
It's been moved and second that the bill be reported. All in favor, please designate electronically.
Ayes 14, no zero.
Ayes 14, no zero, the bill will be reported as amended. Senator Barker?
All right, then the next one is Senate Bill 1005. Patron is Senator Hashmi. It deals with practice of physical therapy. We had some discussions there, and we did not fully resolve everything at the meeting we had last Friday. And there has been stakeholder groups working together, and they have come to a point where they are in at least tacit agreement in terms of how to move forward on this issue between physical therapists and acupuncturists. And with that, I would ask that we have the amendment that has been drafted to deal with that situation.
Madam Chair, there are two new amendments for this bill. The first is at the end of line 61. We're going to insert nothing in this section shall be construed to authorize a physical therapist in the practice of dry needling to fail to comply with the provisions of section 54.1-2956.9. And then the second amendment is in the second enactment clause on line 88. After the word received, we're going to insert dry needling treatment or.
All right, I move those amendments be adopted.
It's been moved and properly second that those two amendments be adopted. All in favor, please say aye.
Aye. Madam Chair,
Senator
Peterson.
Peterson.
Can I ask a quick question?
Yes.
And I had some outreach from acupuncture clinics in my area. Does this resolve their concerns somewhat?
Somewhat, yes.
I believe that is true
Senator
because-
Haspel has been working with
Yes.
the stakeholders, and she can answer that.
Senator Hotchman?
Madam Chair, it resolves the issue somewhat, as we've heard, and the two parties are going to continue to work on this as the bills move through the House as well. So hopefully we'll see a good compromise soon.
Thank you so much. I just like to say to the two groups that met with me yesterday, we had extensive conversation, and I really appreciate the fact that overnight you did exactly what we requested you to do. I wish all of the groups that had differences would do exactly what you've done. It makes it really easy. Thank you both so very much. Senator Barker.
All right, and with that, then, I guess we voted on the amendments. So, then with the two-line amendments, I move that we report the bill.
It's been moved and properly second that the bill be reported with the two amendments. All in favor, please designate electronically.
I'm going to put that on there. I just gotta keep it on there.
Ayes 13, no zero, one abstention.
Ayes 13, no zero, one abstention. The bill will be reported with the two amendments. Thank you.
Yes.
Senator Barker.
All right, the next one is Senate Bill 1105, patroned by Senator Boysko, and that is dealing with the situation with nurse practitioners and licensed certified midwives. What was proposed in the bill was that they make the professions of nurse practitioners and licensed certified midwives they've historically been regulated jointly by the Board of Medicine and the Board of Nursing, but this would propose have them being licensed only by the Board of Nursing. We ended up recommending passing by indefinitely with a letter from the chair to the Department of Health Professions to have an analysis of this done during the off-season here. With that explanation, I'll move that we recommend that we pass this bill by indefinitely with a letter from the chair to the Department of Health Professions.
It has been moved and properly second that Senate Bill 1105 be passed by indefinitely with a letter from the chair. All in favor of that motion, please designate electronically.
Ayes 13, noes 1.
Ayes 13, noes 1. The bill will be passed by indefinitely with the letter from the chair. Senator Barker.
All right, next we have the Senate Bill 1147. Patron is Senator Boysko, and this deals with the bill that's introduced was mandating human trafficking training required of the boards of medicines and nursing. But we ended up adjusting that to where it would be available, but it would not be a mandate, and we have a substitute for that. And so I would.
Could we get a motion on the substitute?
Right.
It's been moved and seconded that the substitute be agreed to. All in favor, please say aye.
Aye.
Senator Barker.
All right, and with adoption of that substitute, then I will recommend that reporting it on an 8-0 vote, and make the motion that we report this substitute.
The motion is that we report the substitute. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The substitute will be reported. Senator Barker.
Yes, next one is Senate Bill 1198. Patron is Senator Saslaw. It deals with the Drug Control Act, and what Senator Saslaw noted was that he had experience of people not being able to get hypodermic needles sent to them through the mail. And there was no clear justification for that. This has been a practice in many instances and in other states as well. And so we ended up recommending reporting of the bill, and I will make that motion to report the bill.
You've heard the motion? And a second, that the bill be reported. All in favor, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported. Thank you so much for that report, Senator Barker.
You're quite welcome.
Next report will come from the Chair on Health Subcommittee, and that will be Senator Lewis.
Madam Chair, could you skip me for just a minute and go on to another one?
Yes,
Trying to get organized here. Thank you.
okay. Then Senator Hashmi, if you're ready, or otherwise we can move to Senator Locke if you're not. Senator Hashmi.
Thank you, Madam Chair. The first bill from the Public Education Subcommittee is SB 787, patroned by Senator D-Step. And this bill would require public school libraries for each local school board to adopt policies to address the selection and evaluation of all printed and audiovisual materials that are purchased or donated or made available in a school division, with procedures for mandatory prior written parental consent, and also for handling challenged controversial materials. We heard individuals in support of this bill from private citizens as well as Family Foundation, Parents for Life. In opposition were the Henrico County School Board, the Virginia Association of School Librarians, the Virginia Library Association. The main concern from those in opposition was the fact that school divisions already have policies in place that address these issues, and that parents are involved in the process of making comments on school materials. They have that option to address those concerns. And finally, also, the argument was made that school librarians are professionals who are trained in the process of making and curating the selections for age-appropriate material. For those reasons, then, the recommendation was that this bill be passed by indefinitely on a vote of 3-2, and I so move.
It's been moved and properly second that the bill be passed by indefinitely, and that's Senate Bill 787. All in favor of the motion, please designate electronically.
Where's Dick?
Ayes 9, no 6.
Ayes 9, no 6, the bill will be passed by indefinitely. Senator Hashmi?
The next bill is Senate Bill 821, patroned by Senator Suravel, and this, excuse me, this bill requires that each division's superintendent identify and update as necessary and make available to the Department of Education and other appropriate individuals, a fax number, email address, and mailing address at which the division superintendent can receive reports required to be transmitted pursuant to relevant law from every state official agency and every sheriff on incidences that are for individuals that have been convicted or arrested on issues of a felony or a Class 1 misdemeanor, and that this be appropriately reported, and that the clerk of the circuit court also, upon the conviction of a Board of Education licensed school employee, make sure that that information is transmitted appropriately. This bill was recommended for reporting in the committee on a vote of 4-0, and I so move.
It's been moved and properly second that the bill be reported, and that is Senate Bill 821. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0, the bill will be reported. Senator Hashmi?
The next bill is Senate Bill 883, patroned by Senator Newman, and there is an amendment, and it's in the packet that we have in front of us, and I move the amendment.
Yes. It's been moved and properly second. All in favor, please say aye. Aye. Senator Hashmi?
This bill would eliminate the requirement that the Board of Education perform a triennial review of the accreditation status of public schools that have been fully accredited for 3 consecutive years. And we would be doing the review on an annual basis. It also eliminates the provision that permits the board to do a review of the accreditation status of any other school once every 2 or 3 years, and the requirement that any such school receiving a multi-year accreditation status other than full accreditation be covered by a board-approved multi-year corrective action plan. So under this bill, the board is now required to review annually the accreditation status of all schools in Virginia. We had a good discussion on this particular bill. The VEA was neutral on it. VDOE supports it. Our Superintendent's Association also remained neutral. This bill was recommended with reporting with the amendment on a vote of 2-1 with 2 abstentions. I was the no vote, so I recommend that we pass this bill by indefinitely, but I know there was division in our subcommittee.
It's been moved and properly second.
No, I don't understand. I guess the recommendation of the subcommittee was 2-1-2. I guess my recommendation is, substitute motion is the bill pass. The entirety of the education community, I think, after we put the amendment on it, was not in opposition to it. Clearly, we have a learning loss. This will allow us to get metrics every year that could be used, and so I would hope that we would pass the bill.
Second.
There is a substitute motion that the bill pass. And I guess maybe we got to vote on the substitute motion. All in favor of the substitute motion, please. Okay, Senate Finance has asked for it, and I guess we will still continue with it. Okay. The recommendation is that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 11, noes 4.
Ayes 11, noes 4. The bill will be reported and re-referred to Senate Finance. Senator Hashmi.
Thank you, Madam Chair. The next bill is SB 1041, patroned by Senator McPike. And I believe there's an amendment in our packet, and I move the amendment.
It's been moved and properly seconded that the amendment be agreed to. All in favor, please say aye.
Aye.
Ayes. Senator Hashmi.
This bill provides that the Board of Education shall require any candidate for division superintendent of a local school division that is serving a locality with a population greater than 140,000 will have either a master's degree or relevant endorsements or a doctorate degree in educational administration or educational leadership administration, and also have at least 5 years of instructional and administrative or supervisory experience in education with no exceptions or substitutes. This particular bill was recommended for reporting with the amendment on a vote of 3-1-1, and I so move.
You've heard the motion?
Madam President, Madam Chair.
Senator Suderline.
May I ask a question briefly so I understand what's going on for this? So I don't have any jurisdictions over 140. It looks like we're primarily entering in and telling the school boards in Hampton Roads and Northern Virginia what they ought to be doing. Is that, if I vote for this, is that what I'm doing?
Madam Chair, the patron is here, and I think he can answer that question best.
Thank you, Madam Chair.
Yes.
Good morning, Madam Chair.
We did say we'd hear from the patron if necessary, and I guess maybe it is necessary.
Good morning, Madam Chair. Thank you. Yes. Well.
No, I did, remember my instructions now, you gotta listen carefully when I make my first statement. I said, when it is necessary, we will hear from the patron. Only when necessary. You asked the question, so it's necessary that he responds.
And it is about making sure there's qualified folks. We just heard bills about learning loss, and we should have those that understand education leading large localities. That's exactly what this bill is about.
Senator Suderline, your heart and mind clear?
Thank you, Madam President. I'm still surprised that you're asking those of us in the western part of, or anywhere in Virginia, to sort of tell Northern Virginia and Hampton Roads school boards how they ought to hire. And what I said, I didn't think we were supposed to do that. That's what I keep hearing, is that they didn't want us intervening in their local school divisions.
Madam Chair,
Senator Peterson.
I have a question. Senator, it seems like the supposition for this bill is that to be experienced enough to be a division superintendent, you must have a public school background.
I got you.
Madam Chair, I'd respond, you must have an educational background, and there's different master degrees or other things, equivalency that would qualify.
All right, let me ask you a further question.
Senator Peterson.
In 1948, Columbia University named Dwight Eisenhower as the president of this university. You know how much educational experience he had? 0. Sometimes you find people outside of the establishment because they can add value. And I think simply bringing people up through the establishment, that doesn't necessarily add value automatically. That's just my opinion.
Unless there's a need for further clarification, we have a motion on the floor. Heart and mind?
I understand what we're doing. Thank you.
So that will determine how you vote. Okay, we have a motion on the floor.
What's the motion?
The motion is to report with the amendment. All in favor of that motion, please designate electronically.
Ayes 8, noes 7.
Ayes 8, noes 7, the bill will be reported with the amendment. Senator Hashmi?
Madam Chair, the next bill is Senate Bill 1044, again patroned by Senator McPike. And this bill requires that each school division that issues a school ID card or student ID card for any grade level, whether it's kindergarten through grade 12, and that any public institution of higher education that issues student ID cards will now, going forward, also include the telephone number for the 988 Suicide and Crisis Lifeline, and that this is only on those cards that are going to be newly issued and any replacement student ID card. The school divisions are not required to go back to previously issued cards and add this provision. So it is for any new cards, this important feature to be added so that students have direct access to a very critical lifeline and support system. This reported out of committee on a vote of 5-0, and I so move.
It's been moved and properly second that the bill be reported. All in favor of the motion, please designate electronically.
Ayes 15, noes 0.
Ayes 15, no 0, the bill will be reported. Senator Hashmi.
Madam Chair, the next bill is SB 1045, again patroned by Senator McPike. There is an amendment to this in your packet, and I move the amendment.
It's been moved. Second, that the amendment be agreed to. All in favor, please say aye. Aye. Senator Hashmi.
This bill requires that each school board will establish and include in any multi-year capital improvement plan or substantially similar document that it adopts a school building maintenance reserve target of at least 1.5% of the replacement value of such building in order to avoid major replacement costs in the future. And this bill comes out of a recommendation from the Commission on School Construction and Modernization. And we heard from just one concern from our superintendents, asking that the state will also continue to help fund those smaller localities that are struggling with maintenance issues for their school construction and modernization. But otherwise, we, as a committee, recommended this bill for reporting with amendments on a vote of 5-0.
This
And I
bill
so
has,
move.
it has not been requested by finance, but I think the chair would like to have it go to finance. Am I correct? Senator? No, it was not previously requested, but I think she just did it a couple of minutes ago. Senator Howard?
I just thought I'm surprised it wasn't requested, but no, I'm not going to ask that it go.
Okay, all right. So the motion is that the bill be requested with the amendment but with no request to go to finance. All in favor of that motion, please designate electronically.
Ayes 14, no zero, one abstention.
Ayes 14, no zero, one abstention. The bill will be reported with amendment. Senator Hashimi.
Thank you, Madam Chair. The next bill is Senate Bill 1146, patroned by Senator Boysko, and this is concerning the possession and administration of epinephrine at early childhood care and education entities. It is limits in the context of early childhood care and education. It adds the requirement for the implementation of policies for the possession and administration of epinephrine at child day centers. And under current law, this requirement applies to all early childhood care and education entities, which includes child daycare centers, family day homes, and so forth. But the bill also requires that the Board of Education amend its regulations to require each family day home provider or at least one other caregiver who's employed by the provider in a family day home to also be trained in the administration of epinephrine and to notify the parents of each child who receives care whether the provider stores an appropriate weight-based dosage of the medication at the residence. This bill comes out of a very tragic incident in which a child was lost without because the family daycare did not have the necessary medication on hand. This bill was recommended for reporting on a vote of 5-0, and I so move.
It's been moved and properly second that the bill be reported. All in favor of that recommendation, please vote electronically.
Ayes 15, no zero.
Ayes 15, no zero, the bill will be reported. Senator Hashmi, the next bill will be, has been requested by Finance, 1199, but please present.
SB 1199, patroned by Senator Reeves. We had considerable discussion around this issue of parental rights to education transparency. The bill would ask that all parents have access to a list of any printed or audiovisual instructional material, participate in textbook review, and there are many requirements that are here. I will not read all of them. We had considerable discussion in committee around this bill, and there was testimony provided that our school divisions provide this information to parents in a variety of formats. Some of the concerns were around Romanet number 5, especially that parents receive advance written notice of any school-sponsored field trip, activity, assembly, presentation, and so forth. Our school divisions and others pointed out that parents receive this notification. In fact, they have to provide consent, especially for field trips, but the language was very broad when you're thinking about any assembly or activity that could include also pep rallies, schools' pep rallies before any athletic opportunities, and therefore we recommended passing by indefinitely with a letter from the chair to the Department of Education asking for clarification on these various issues and where the school divisions do the reporting and how they do it. And I so move.
It's been moved and properly second that the bill be reported. All in favor, I'm sorry, that the bill passed by indefinitely. I saw your face. It has been moved and properly second that the bill be passed by indefinitely, and that's Senate Bill 1199. All in favor of that motion, please designate electronically.
Ayes 12, noes 3.
Ayes 12, noes 3. The bill will be passed by indefinitely.
Madam Chair, just for clarification, I think that was passed by indefinitely with letter, correct?
With letter, yes.
Thank you, Madam Chair.
The letter will come from the clerk.
Thank you, Madam Chair.
You're so welcome, sir. Senator Hashmi, you have one more bill in your committee.
Thank you, Madam Chair. Yes, the final bill in our docket was Senate Bill 1253, sponsored by Senator Donovan, and it is requiring each school board to provide teachers, parents, principals, and other school leaders with their students' results on any SOL assessment or alternate assessment program as soon as practicable after the assessment is administered. This particular bill was recommended for reporting on a vote of 5-0, and I so move.
It's been moved and properly second. You heard the motion. All in favor of reporting the bill, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported. Senator Hashmi, I thank you so much for your report. On the docket, of course, we would be moving to the subcommittee on education, but we're going to circle back and let Senator Lewis make his presentation on his subcommittee, and then we will go to Senator Locke on higher education.
Thank you, Madam Chair. Madam Chair, the Subcommittee on Health heard first Senate Bill 925 by Senator Cosgrove, which required hospitals, nursing homes, and certified nursing facilities to allow, first of all, Madam Chair, there is an amendment in the nature of substitute. Let me get that in front of us. I would move the amendment in the nature of substitute.
It's been moved and properly second that the amendment be agreed to. All in favor, please say aye.
Aye.
Senator Lewis.
So now, Madam Chair, Senate Bill 925 will require hospitals, nursing homes, and certified nursing facilities to allow patients to receive visits from clergy members during a declared public health emergency related to a communicable disease. We heard extensive testimony from the hospitals and also nursing homes about some serious concerns they had with the bill, especially in light of the bill that was passed last year, Senator Kagan's bill, which allowed or encouraged the such visits during public health emergencies. So after that testimony, Madam Chair, it was the recommendation of the subcommittee that the bill be passed by indefinitely, and the recommendation was 5-0, and so I would move that the bill be PBI'd.
We have a motion on the floor. It's been moved and properly second that the bill be passed by indefinitely. All in favor of that motion, please designate electronically.
Next, Madam Chair, we took up Senator Favola's.
Senator Lewis.
Yes, Madam Chair. Next, Madam Chair, we took up.
Senator Lewis,
I'm sorry.
hold 1 second.
Oh, I'm sorry.
Ayes 14, noes 1.
Oh, I'm sorry.
Okay.
Next, we had Senator Favola's.
Ayes 14, noes 1. The bill will be passed by indefinitely. I'm with you, Senator.
I'll get there. I'll get there. Senate Bill 926, Senator Favola, and there are some amendments in our packet for that, and I would move the amendments.
You've heard, it has been moved and properly second that the amendment be agreed to. All in favor, please say aye. Senator Lewis.
Madam Chair, this Senate Bill 926 establishes the Emergency Department Care Management Grant Program and the Emergency Department Care Management Grant Fund. And this is to address frequent users of hospital emergency departments and methods of having them rely upon the emergency departments less frequently. It was a recommendation of the Joint Commission on Healthcare, and the goal is to reduce the use of the emergency room and set up care management in communities to avoid frequent use of the emergency room. And so after a presentation by Senator Favola, it was recommended on a vote of 5-0 by the subcommittee that we recommend reporting to the full committee and also referring to finance. So I so move.
You've heard the motion that the bill be reported and re-referred to finance. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported and re-referred to finance with the amendments. Senator Lewis.
Next, Madam Chair, we took up Senate Bill 945 by Senator Suderline. Madam Chair, this is a bill that actually was introduced by Senator Suderline last year, made it through this committee and also made it through the Finance Committee and ran into some trouble on in the other chamber. What this bill does is direct the Department of Medical Assistance Service, DMAS, to take steps to amend the family and individuals community waivers to provide greater financial flexibility. Currently, there are two pots of money, two caps, $5,000 each, and what this will do will allow them to combine the two because the current existing cap is not sufficient for assistive technology. And so when we combine them, it'll give the individual the flexibility for using up to $10,000 for that type of technology. And so it was the recommendation on a vote of 5-0 from the subcommittee that we recommend reporting. So I would move that we report and re-refer to finance.
You've heard the motion that the bill be reported and re-referred to finance. Did I hear a second? It's been moved in second. All in favor of reporting and re-referring Senate Bill 945 to finance, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and re-referred to finance. Senator Lewis.
Next up, Madam Chair, was Senator Suderline's 1016, Senate Bill 1016. And it exempts from the Board of Health regulations governing bedding and upholstered furniture, any items of bedding or upholstered furniture that are 75 years or older. Essentially, this has been the practice of the Health Department for a number of years, not to include those, but it was brought to the Health Department's attention from the Attorney General's office that the language of current code actually probably did require them to consider or deal with those items. And so what this does is just recognize the longstanding health practice of the Health Department. After testimony from the Health Department, it was and presentation from Senator Suderline, it was the recommendation of the subcommittee on a vote of 5-0 that the bill be reported, and I so move.
It's been moved and properly seconded that the bill be reported, but also it has been it has also been requested by the Chair of Senate Finance.
Oh, okay.
What happened?
I didn't have that one.
Say again, what happened? That is
945 was.
9:45. I have finance here. Okay. The Chair of Senate Finance does not want that bill. That doesn't mean she's not gonna vote for it, but she doesn't want it. She doesn't want it. Okay, you've heard the motion. The motion is to report the bill. All in favor of that motion, please vote electronically. Bedding and upholstery.
Ayes 14, no zero.
Ayes 14, no zero. The bill will be reported. Senator Lewis.
Next up, Madam Chair, we took up Senator Boysko's 1104, which actually was passed out as a concept. And the concept was that by the time it got here, and I assume there's a substitute somewhere, that in concept, it would be.
Is there a substitute?
Is there a substitute? Yeah, okay, so I'd move the substitute first, Madam Chair.
It's been moved. Second, that the substitute be agreed to. All in favor, please say aye. Thank you. Senator Lewis.
So the concept was, as embodied in the substitute, that Senator Boysko's 1104 would become a Section 1 bill directing the Department of Medical Assistance Services to study hospital-based violent intervention programs, which provide services to violently injured people to avoid repeat injuries, post-traumatic stress disorder, and retaliatory injuries so that they don't end up back in the hospital again, the victim of that violence. And so after the concept that was advanced in subcommittee, it was recommended on a vote of 5-0 that we report. And also finance wants this, so my recommendation is that it be reported and re-referred to finance.
You've heard the motion, that the bill be reported and re-referred to finance. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and re-referred to finance with the substitute. Senator Lewis.
Madam Chair, we next took up Senate Bill 1155 from Senator Mason. There are amendments to that, and I would move the amendment. There were amendments made, and I would move the amendments.
It's been moved and seconded that the amendments be agreed to. All in favor, please say aye. Senator Lewis.
And what this bill does, Madam Chair, is requires the Commissioner of Behavioral Health or his authorized agents to make at least one unannounced inspection of each service offered by each licensor during the licensing period. Current law requires an annual inspection. So what this does is bring the inspection process in line with the licensure. So there are one-year licenses and there are three-year licenses. And so if you have a one-year license, it'll be an annual inspection. If you have a three-year license, the inspection will take place every 3 years. And there's no prohibition against an inspection taking place immediately if there's some report of some problem. This was the amendments adopted by the subcommittee and just adopted by the full committee makes clear that this change will in no way conflict with the Department of Justice settlement. And so upon those amendments, it was recommended by the subcommittee that the bill be reported on a vote of 5-0, and I so move.
You heard the motion and the second. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the amendment. Senator Lewis.
Next up, Madam Chair, we took up Senator Donovan's 1232. There is an amendment in the nature of a substitute, which I would move.
The substitute has been moved and second. All in favor of that motion, please say aye. Aye. Thank you, Senator Lewis.
And Senator Donovan's bill clarifies that the deaths of individuals who are or were immediately prior to admission to another hospital receiving services in a state hospital training center operated by the Department of Behavioral Health must be investigated by the Officer of Chief Medical Examiner, whether the death of the individual was expected or unexpected. So what this does is requires, and as it says, requires an investigation and not an autopsy, just an investigation into the death. And so after testimony and presentation by Senator Donovan, it was recommended by the subcommittee that the full committee report, and the recommendation was a 5-0 vote. And so I would move we report with a re-referral to finance.
You've heard the motion and second that the bill be reported and be re-referred to Senate Finance with the substitute. All in favor of that motion, please designate electronically.
Senator Lewis, please vote. I think you want to vote yes.
What have I done?
It's there.
I appreciate the confidence, Senator Speaker.
Ayes 15, no zero.
Ayes 15, no zero. Senate Bill 1232 will be reported and be referred to Senate Finance with the substitute. Senator Lewis.
Next, Madam Chair, we took up Senator Cosgrove's 1234. This was some interesting testimony, Madam Chair, on transcranial magnetic stimulation, and it's a treatment which I think first was developed for autistic children and saw some success there, but has been applied to veterans and first responders and law enforcement officers, and for post-traumatic stress issues, substance abuse issues, depression issues. The therapy seems to be very effective. And so what this does is require the establishment of a pilot program for veterans and first responders and law enforcement officers. After presentation by Senator Cosgrove and also by testimony from directly on the program and therapy itself, it was the recommendation of the subcommittee that the full committee report, and the recommendation was 5-0, and I would so move.
It's been moved. Senator Cosgrove. Yes, it does. It's been moved and properly second that Senate Bill 1234 be reported and be referred to Senate Finance. And the Chair of Senate Finance said we will not make it out of finance until summer. And so with that motion, all in favor, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and be referred to Senate Finance. Senate Bill 1276. Senator Lewis, another one that's going to go to Finance.
Yes, it is. It's from Senator Donovan, Madam Chair. Madam Chair, I believe there's an amendment to put in a delayed effective date on this to January 1, 2024, and I would move the amendment.
It's been moved and properly second that the amendment be agreed to. All in favor, please say aye.
Aye.
Senator Lewis?
So the bill requires if a decedent is inmate is in the custody of the Department of Corrections, that an autopsy be performed by the medical examiner when they pass away. Currently, sheriffs, as I understand it from Senator Donovan, sheriffs and jails do this by policy. The Department of Corrections does not do it, and we've heard testimony that it would result in probably about 20 more autopsies a year. The Department of Corrections testified they do not have a position on the bill, but as I understood from their testimony, they thought it would be a helpful measure. And so after those presentations and testimony, it was recommended by the subcommittee that the full committee report the bill and refer to finance on a 5-0 vote, and I so move.
You've heard the motion and the second that the bill be reported and be referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and be referred to Senate Finance with the amendment. Senator Lewis.
Next up, we had Senator Barker's 1344. There's an amendment in the nature of a substitute, and I would move the substitute.
There's a motion on the substitute. Moved and properly second that the substitute be agreed to. All in favor, please say aye. Aye. Senator Lewis?
This bill is pretty straightforward, Madam Chair. It allows the City of Alexandria to enter into a contract with the Department of Health for the local administration of local health services. We've done this with other jurisdictions in Northern Virginia, and so it was the recommendation of the subcommittee on a 5-0 vote that we recommend reporting, and I would so move.
It's been moved. Second that the bill be reported. All in favor of that motion with the substitute, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported with the substitute. Senator Lewis.
Next up, Madam Chair, was Senator Pillion's 1414, and there is a substitute, so I would move the substitute.
It's been moved and second that the substitute be agreed to. All in favor, please say aye. Aye. Ayes have it. Senator Lewis.
Madam Chair, this bill deals with the opioid settlement funds coming to the state of Virginia, and it establishes the Commonwealth Opioid Abatement and Remediation Fund to receive those funds. As I understand it, I think the funds could only be used for opioid abatement purposes. So it was the recommendation of the subcommittee on a vote of 5-0 that we recommend reporting, and I would so move.
Second. It's been moved and second that the bill be reported and be referred to Senate Finance. All in favor of that motion, please designate electronically. Senator Pillion. Senator Lewis.
Next up on the Pillion docket was 1415, Madam Chair. This was there are amendments on that, so I would move the amendments.
It's been moved and probably second that the amendment be agreed to. All in favor, please say aye. Ayes have it. Senator Lewis?
Madam Chair, Senate Bill 1415 directs the Department of Health to create the Commonwealth Opioid Impact Reduction Registry, consisting of nonprofit organizations that work to reduce the impact of opioids in the Commonwealth. And the bill also allows any person to possess and administer naloxone or other opioid antagonist for use other than in injectable form, so the nasal version of this, not the needle version of this. And so, Madam Chair, after presentation from Senator Pillion, it was the recommendation of the subcommittee that the bill be reported, and that recommendation was on a 5-0 vote, and so I so move.
Second.
And to be referred to Senate Finance. It's been moved and properly second that Senate Bill 1415 be reported and be referred to Senate Finance with the amendment. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and be referred to Senate Finance with their amendment. Senator Lewis?
And finally, Madam Chair, we had Senator Pillion's 1418. This was a state plan for medical about telemedicine, establishes that the healthcare providers are not required to maintain a physical presence in the Commonwealth to maintain eligibility to enroll as a Medicaid provider. So if what was happening is to be eligible for a Medicaid provider, you had to have a physical address in the Commonwealth. And what this says is if you're licensed in the Commonwealth but don't have a physical address in the Commonwealth, you can still participate in the Medicaid program. And what this does, the testimony was that what this does is expand our Medicaid providers, especially in areas that need more providers. And so, after hearing the testimony and presentation by Senator Pillion, it was recommended on a vote of 4 with 4 yes, 1 abstention that we recommend reporting, and I would so move.
It's been moved and properly second that the final bill on the Pillion docket for today be reported. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported.
And that completes my report, Madam Chair.
Thank you, Senator Lewis. And I wish I could say that we were done, except that we haven't finished Senator Locke yet. So now we will hear from the chair of Higher Education Subcommittee. And Senator Locke, before you get started, I know
I have several that
I
will
have
go to
several bills that go to finance. I do as well. And of course, as you all know, I know there have been people waiting to hear what's going to happen to Senate Bill 1211. And of course, that bill will go directly to finance as well. But Senator Locke, you may proceed with your report.
Okay. We had several bills in the Higher Ed Subcommittee. We began with Senate Bill 955 from Senator Ruff. This bill provides that public institutions of higher education may enter into special arrangement contracts with the Virginia Department of Military Affairs for the purpose of providing reduced tuition rates for any member of the Virginia National Guard receiving state tuition assistance grants. And the subcommittee recommends reporting on a vote of 5-0, and I so move and that this bill be reported and re-referred to Senate Finance.
It's been moved in second that Senate Bill 955 be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and re-referred to Senate Finance. Senator Locke?
Next, I believe, is Senate Bill 1020 from Senator Edwards. We had this bill before. This bill establishes the Virginia Museum of Transportation as a public entity and educational institution under the Commonwealth and to be governed by a 15-member board of trustees. The subcommittee also recommended that this be reported and on a vote of 5-0, and I so move and that we report this bill and we refer to Senate Finance.
You've heard the motion? Is there no second? Second. You've heard the motion and second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported and re-referred to Senate Finance. Senator Locke.
Senate Bill 1077 comes from Senator Ruff, and the subcommittee moved to incorporate Senator Norman's 1450 into Senate Bill 1077.
Okay.
And I move that.
It's been moved and second that the bill be reported, that the bill
Incorporate
recommend
Senate
reported
Bill.
with,
No.
incorporate Senate Bill 1450. That is the motion?
Yes.
Okay, you've heard the motion and the second. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero, and that bill will be reported.
No, ma'am. We just incorporated 1450.
Okay, so if it's gonna incorporate 1450, and it's, okay, it's been separated. All right, gotcha. Thank you.
So now we have a substitute before us, and what the substitute does, it removes the authority of the Board of Visitors of the College of William and Mary in Virginia to supervise, manage, and control Richard Bland College, and establish a 12-member Board of Visitors of Richard Bland College to generally direct the affairs of the college, which includes appointing all teachers and fixing their salaries, providing for the employment of other personnel as required, and caring for and preserving all property belonging to Richard Bland College.
Got it.
And the subcommittee recommends reporting the substitute on a vote of 5-0, and I move that we report and we refer to Finance.
You've heard the motion? Anybody need coffee? Second. It's been moved and second that the bill be reported and be referred to Senate Finance with the substitute. All in favor of that motion, please designate electronically.
Ayes 14, noes 1, 1 abstention.
Ayes 14, no 0, 1 abstention. The bill will be reported and be referred to Senate Finance with the substitute. Senator Locke.
Senate Bill 1193, Senator Reeves's bill. There is an amendment, and I move the amendment.
It's been moved.
Or a substitute. You know, there's a substitute.
The substitute has been moved and second. All in favor, please say aye. Ayes have it. Senator Locke.
Okay, initially, this bill prohibited employees of public institutions from participating in Chinese-sponsored talent recruitment programs or receiving Chinese-funded grants. What the substitute does is it removes all of that language and basically says that each public institution of higher education in the Commonwealth shall disclose to the council any financial gifts, bequests, grants, or payments received from any contracts entered into with any foreign government by the institution or any employee of that agent. So they will now report what they already do. So it was recommended for reporting on a vote of 3-2. And I will move that we report and recommend, and we refer to Senate Finance.
You've heard the motion? And there's a second. All in favor of that motion to report and refer to Senate Finance with a substitute, please designate electronically.
Ayes 11, noes 4.
Ayes 11, noes 4. The bill will be reported and be referred to Senate Finance with a substitute. Senator Locke.
Senate Bill 1197, from Senator Reeves, basically would impose several requirements on governing boards of public institutions of higher education relating to transparency, and it includes several requirements, including making reports to the chairman of House committees on appropriations and the Senate Committee on Finance and Appropriations, reports on the full board and their committees, making available on their institution's websites, information on their board meetings, information on the number of diversity officers and government relations officers that are employed by the institutions and their salaries, information relative to the percentage of expenditures used for diversity, equity, and opportunity, compensation, government relations, and lobbying activities, and compensations of the chief executive officers, among many other requirements relative to transparency. The subcommittee recommends passing by indefinitely on a vote of 4-1, and I so move.
You've heard the motion? Second. And a second, that the bill be passed by indefinitely. All in favor of that motion, please designate electronically. Senator Edwards, vote please. Thank you.
Ayes 13, noes 2.
Ayes 13, noes 2. The bill will be passed by indefinitely. Senator Locke?
Okay, Senate Bill 1202, also from Senator Reeves, makes eligible for in-state tuition at public institutions for higher education, regardless of domicile, any non-Virginia student who is a member of the Virginia National Guard and who is eligible pursuant to relevant law for a grant in the amount of the difference between the full cost of tuition and any other educational benefits for which that student is eligible as a member of the Virginia National Guard. And the subcommittee recommends that this be reported on a vote of 5-0, and I move that we report and re-refer to Finance.
Second. It's been moved and second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. The bill will be reported and re-referred to Senate Finance. Senator Locke?
Senate Bill 1307 comes from Senator Deeds, and this bill expands the membership at the University of Virginia Board of Visitors by the inclusion of one faculty member and one staff member. And the subcommittee recommended reporting on a vote of 4-1, and I make that motion.
Madam Chair,
Senator Peterson?
I think it's important to note they're non-voting members.
Yes, non-voting members.
Right.
Thank you for that clarification. You've heard the motion? And there's a second. All in favor, please designate electronically.
Ayes 9, noes 6.
Ayes 9, no 6. The bill will be reported. And Senator Locke, did you ask for that to be re-referred to Finance?
No, ma'am.
Okay. And Finance does not want it.
I haven't finished the Finance docket yet.
Okay, thank you.
Senate Bill 1356 comes from Senator Reeves. This bill establishes the Virginia Promise to Veterans Act for the purpose of removing barriers to higher education for veterans of the uniformed services and assists veterans in making the transition to civilian life by the furtherance of their education as defined by the Act. And the subcommittee recommends reporting on a vote of 5-0, and I make that motion and re-refer to Finance.
You've heard the motion and a second that the bill be reported and re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. Senate Bill 1356 will be reported and referred to Senate Finance. Senator Locke.
I believe this is my last bill. Senator Vogel has Senate Bill 1373, which directs the governing board of each public institution of higher education to develop and implement policies requiring trauma-informed human trafficking awareness and prevention training programs to be provided and completed to all first-year students as a part of their first-year orientation programs. And the subcommittee recommends reporting on a vote of 5-0, and I'd so move.
It's been moved and properly second that the bill be reported and be referred to Senate Finance. All in favor of that motion, please
No,
designate.
this doesn't go to finance.
Without going to Senate Finance, all in favor of that motion, please designate electronically.
Ayes 15, no zero.
Ayes 15, no zero. The bill will be reported.
And that completes mine.
And that concludes Senator Locke's report, and I thank you. I'm looking at Senate Bill 1450, but that bill has previously been
That was
incorporated, so we're done with Senator Locke's report. Thank you. And now we will go to the bills that are before the committee, and I see the clerk has cleaned up my docket here for requests to speak, but the first person up is none other than Senator Bill Stanley.
I won.
That's Senate Bill 806.
Good morning, Madam Chair, members of the committee. Senate Bill 806, if it please, earlier on, a couple years back, we, through a bill that I sponsored, created a one-time fund to fund STEM education through the competitive teams of robotics. And especially for those areas that were at or below the poverty levels, because many times those schools cannot afford robotics teams and enter into these STEM-C competitions because they don't have the funds or their parents don't have the funds. From that initial award, we were able to fund and fully fund so many schools' robotics teams that started for the first time. One story, as I will tell you, is our robotics team in the Martinsville, Henry County area, which had not existed before, was able to start up and actually go to nationals and compete, and in one state. So the effectiveness of what you did years ago is enormous. And I am always reminded, too, that, you know, having wanted to be an athlete, a professional athlete, and playing sports, and when you play sports in high school, you think that you have that dream, but the chances of going pro are minuscule. But, ladies and gentlemen of this committee, every single member of every robotics team has the ability to go pro and be in a chosen field and create in the talent pipeline that Commonwealth needs so very much, those advanced credentials and degrees that we need for the 21st century marketplace. So this bill, Senate Bill 806, is not my bill. It's not. Students over here came to me over the summer and wanted to be immersed and participate in the legislative process. All of these students are members of robotics teams in schools in more affluent school subdivisions. And so they came and they asked, can we do something about that for those children that may be in the 60% free or reduced lunch categories that couldn't afford these robotics teams? And I told them that I would be happy to sponsor the bill, but they would have to do all the work. So, Madam Chair, if you don't mind, we have students from Deep Run, Thomas Jefferson High, Richmond City Schools, maybe even Maggie Walker, who have been working all summer on this bill with other groups, other students throughout the Commonwealth of Virginia to gain support. They have been working the phones. You may have received phone calls. They have been working the emails to gain support. So, Madam Clerk, if you would indulge me, I would ask that these students who have done all of the participation on putting this bill together, its drafting, and getting it in final form, that they be able to present this bill to this committee. And I will remind you, Madam Chair, that ironically enough, we had the $200,000 which originally fed the initial program, which was a one-year program. It has continued to appear in the budget, so it is currently in our budget, and the governor didn't strip it out. So I don't know if it has to go to finance, but I'm guessing it will. But and I have a lot of explaining to do to the chairman of finance. But if you would allow these students to come up and present this bill, I would be so honored.
Senator Stanley. Please state your name and proceed with your presentation.
Madam Chair and members of the committee, good morning. My name is Kieran Saberwall. I'm a senior in high school and a member of the Deep Run High School First Robotics team. I've been a member of a STEM plus C competition team since 4th grade. Throughout this journey, I've learned how to design, build, improve, code, and drive a robot. I've learned how to research effectively, how to talk to experts, and how to adapt to a lot of failure. But more importantly, I have learned lessons that go far beyond robots. I can confidently say I'm a better critical thinker, problem solver, collaborator, teammate, communicator, and advocate because I am a member of a STEM plus C competition team. Through such programs, I not only have the amazing opportunity to talk to you today, but I also have the confidence to do so. SB 806 is an opportunity to help Virginia students across the state become engineers, scientists, and coders, but also to help them become better communicators, problem solvers, and collaborators. However, while STEM plus C programs are invaluable, they are not available to many students. For example, the high school that I attend does not have a robotics program. I was fortunate enough to be able to join the Deep Run team, but many Virginia students are not able to do so. Every year in January, my 100-plus member team meets together to celebrate the release of the annual Robotics Challenge. This year, we watched a live stream with Dean Kamen, the founder of First Robotics. I'd like to share a quote he always says. "We don't use kids to build robots. We use robots to build kids." I hope kids K through 12 in Virginia can have the same life-changing experiences I've had in STEM plus C competition teams. Thank you.
Madam Chairperson and members of the committee, good morning.
Good morning.
My name is Ellie Irwin, and I'm an 11th grader at Thomas Jefferson High School in Richmond. I'm a member of the school's robotics team. I like it because I get to program, help build a robot. It's real cool, especially when I get to reverse engineer parts of the robot and be a part of the design team. I also get to use drills and other power tools to help the construction of the robot. It's cool because we get to work together as a team to do things we otherwise would never dream of doing before. I've made new friends, and my teammates now want to be part of STEM-related fields. We are so inspired by the engineers who mentor us. However, this all takes funding. And unfortunately, we have to work very hard to get funding. And we do not have the support from our school systems. And we are not in the position to ask families to contribute either. So support the STEM competition activities would not only be good for urban schools and rural schools, but also schools that do not have the opportunity for STEM programs. Thank you.
And what school did you say you attend?
Thomas Jefferson High School.
And that's where?
It's in Richmond Public School.
She said Richmond Public Schools. Yeah. Yeah.
It's more than
Yes.
y'all.
No, Senator, I think Senator Saslaw thought we were talking about the one in Northern Virginia. That's why I wanted clarification. Thank you.
Thank you.
Madam Chair and committee, this will be really
Yes.
quick because I did pay attention to your 5 minutes this morning. So I am Wendy Newton. I'm a mentor for 1086 robotics teams, and I'm not an educator by trade. I work in the cybersecurity field. I've been mentoring kids for over 13 years. I got involved when my daughter first joined. However, outside of robotics as well, I've had the privilege to be able to do outreach through Society of Women Engineers, Richmond Area Program for Minorities in Engineering, Girls Excelling in Math and Science, and the James River Juvenile Detention Center, among others. These students that we get the opportunity to work with that don't have these opportunities in their schools are really missing out on this inspiration. One summer at James River, one of the girls that I was working with told me that her mother told her girls don't do these types of jobs. They're not seeing this in their school. She did not have a team at her school. This is not an opportunity that they get. Over the course of my career in hiring, I've noticed there is a distinct lack of diversity in applicants. Studies have shown the sooner we reach these students, these girls, the underserved students, the more likely they'll be to be inspired to go into STEM fields. So I ask you to please support this bill so that all these students have these opportunities. Thank you.
Thank you.
Good morning, Madam Chair, members
Good
of the
morning.
committee. I bet you wonder, why is Susan Gaston standing before you? Because I am clearly not a student, and they leave a hard act to follow. I am here on behalf of my client, SVT Robotics, which is based in Norfolk, Virginia. SVT is a startup. They have been around for about 4 years now, and we partner with a robotics and a STEM club in Norfolk, Virginia, that is comprised of young men aged 12 to 15 who want to get into the technology engineering space. And much like these students said to you, it is very difficult for many individuals in a economically depressed situation to get into the technology engineering programs. We very much support Senator Stanley's initiative because we see that it's going to provide those opportunities. And it is also very much connected to the initiatives around workforce development. My CEO looks at this opportunity with our STEM clubs as the way to create a tech talent pipeline. So we support this legislation and urge you all to do the same. And I'm happy to get our CEO in front of you anytime and come visit the robots in Norfolk. Thank you.
Thank you, Susan. Susan?
Yes, ma'am.
Just as you were about to get started, there's one other person who can identify with the statement I'm about to make. Senator Howell and I came in when Hunter Andrews was chair of finance, and he was chair everything.
Yes, sir.
And he
Yes, ma'am.
reminded us that we were going to always be students.
You are correct. But I'm certainly not the age of these students, but they really are amazing, amazing young people, and we need to support them.
Thank you.
Madam Chairman,
Senator Howell?
I have
Yes,
a
ma'am.
question. Why does your client only deal with men?
The club that they are involved with in Norfolk has a partnership with the Norfolk Police Foundation. And the foundation has identified this group of young people as very much vulnerable, but they want to be part of the technology community. And we did not identify who is in that club. It is through the partnership with the Police Foundation. And it creates a number of different opportunities in addition to trying to build a positive connection between law enforcement and very vulnerable students. But most importantly, to see the hope that these young people have. I can find out more for you.
We'd like to know.
Okay.
Yeah,
It's
in
very
fact-
positive. And I will say as well, Delegate Angela Williams-Graves has a budget amendment to support this in the House through the Truth STEM Entrepreneurial Club in Norfolk.
Madam Chairman,
Senator Howell?
I would just follow up that there are many young women who also are at risk and also are very talented and could probably benefit from this.
I will share that message with the club, Madam Chair.
Thank you.
Thank you so much.
Madam Chair, Tom Smith with the Superintendent's Association. As part of their efforts this summer, they reached out to our national organization, AASA, and got their support, and so they referred it to me, and so we're in strong support of the bill.
Thank you.
Madam Chair, Jay Deck with the Virginia Education Association, and we support the bill also.
Thank you, Jay. Senators, I need to ask the question, are there any members who would like to be heard who are on Zoom?
For those on Zoom who would like to speak on the bill, you may raise your hand. We have no speakers, Madam Chair.
Thank you. Senator Stanley.
Madam Chair, members of the committee, I mean, it's emotional for me a little bit because they've worked so hard. I know we gave, through NCI, NSBE, National Society of Black Engineers, the students at Martinsville, $25,000 to start for the first time the robotics program. We allow them to work on it at the Institute, and we have seen that membership grow and double in size. The opportunity here is not just a one-off type of thing that we did before, but this would be a revolving account. And as these students made sure that they wanted this bill to create opportunities for those in those schools that would not have had them otherwise, and have not had them. And I think that's a noble effort, and this is one of those things and one of those bills where government can do the best work. My daughter, it's changed her life. She participates in a robotics program, and I hope you find the bill favorably.
Thank you so much for that
Madam Chairman.
presentation. Senator Cosgrove.
Thank you, Madam Chairman. I'm not a lawyer that, is on courts. I'm not a doctor who, unlike my colleague to my left, knows all about medical, but I am an electrical engineer. I got to tell you, this whole robotics program is incredibly valuable, incredibly important. It prepares these young people to go into life to have fantastic futures. And they have such a jump start from this type of program. I've been to several robotics competitions, and it is absolutely amazing. So, Madam Chairman, I certainly hope that this will get a unanimous recommendation both out of this committee and I hope out of Senate Finance, and I would move to report this bill.
It's been moved and properly second that the bill be reported. You've heard the motion. All in favor of, anyone else like to speak? Senator Donovan.
I just have to do a shout out to Blue Cheese from Deep Run. I think she stepped away. I think we've all probably been to these robotics competitions in our own districts.
Yes.
And this is one of the greatest things for kids and for girls. And I am just so excited. It's not for boys. I'm just saying access means opportunity. So thank you so much for this bill.
Thank you.
You've heard the motion and the second, that the bill be reported and be re-referred to Senate Finance. All in favor of that motion, please designate electronically.
Ayes 15, no 0.
Ayes 15, no 0. Congratulations, students. Next on the docket is Senator Lewis's Senate Bill 1164. Senator Lewis? Okay, you don't want any testimony on it? No. Okay, all right. Okay, if that being the case, I will now turn the gavel over to Senator Saslaw because the last three bills on the docket will be those of your chair. Senator Saslaw, you have the gavel. I'm going to start with 1175.
All right. The first of Senator Lucas's bills will be Senate Bill 775, the Student Literacy Measures Scope of Students in Grades 4 through 8.
Well, I could have stayed up there. Okay. Good morning. I'm proud to be here this morning as a patron of Senate Bill 1175, a bill to expand the Virginia Literacy Act, which we passed unanimously last year to ensure our kindergarten through third grade students learn to read. I'm also proud to have worked on this legislation with Delegate Kerry Connor, who has introduced the companion bill in the House of Delegates, and that's House Bill 1526, and a team of the University of Virginia School law students and local government policy clinic. Now, before law student Samara explains the details of the bill, I want to take a moment to explain why it's important. First, following on the heels of the pandemic, the number of students who have not learned to read at grade levels across the Commonwealth has exploded. Here are some 2022 data that demonstrates that point. 35% of Virginia's second grade screen well below benchmarks in reading. 32% of third graders failed to read SOLs, and 68% of fourth graders were not prolific on the NAEP NEP reading assessment. Second, the data are even worse for our students of color, our students from low-income backgrounds, our children who are English language learners, and our children with disabilities. These are the most vulnerable learners. Third, the students represented in these percentages will be in fourth grade and above before the reach of the current Virginia Literacy Act, when it takes effect at the fall of 2024. If we do nothing, these children will enter school and classrooms that we know do not have the resources they need to teach them to read. Finally, if we don't act now, these children will move to high school without a key literacy skill. They will be 4 times more likely not to earn a high school diploma. We will have not knowingly let them fail. Fortunately, I do have some good news. The research is clear that with the literacy instructions and support that this bill requires, the vast majority of these students will become prolific readers by 8th grade and will enter high school on a track to graduate. To quote, I almost choked, our governor, we are at risk of losing a generation of children. Uh-oh, that's going to be on Twitter this afternoon. It is up to us to keep that from happening. Senate Bill 1175 is designed to do just that, and I ask for your support. I would now ask Samara to be able to speak to the bill. Samara?
Thank you, Chair, members of the committee. My name is Samira Nematalahi, and I'm a third-year law student at the University of Virginia, participating in the State and Local Policy Clinic. The views I expressed today are my own and not those of UVA or the law school. I'm here to speak in favor of this bill. This bill expands on important legislation, the Virginia Literacy Act, that the General Assembly unanimously passed last session. SB 1175 extends the VLA's reforms to ensure 4th through 8th graders in the Commonwealth also receive the evidence-based literacy instruction they need to learn to read. For students in grades 4 and 5, this bill will ensure they receive evidence-based literacy instruction in their core classrooms. It also provides targeted intervention and expands the number of reading specialists in our elementary schools to support this work. This bill also recognizes that building reading proficiency does not end in elementary school. This is particularly true in the wake of the pandemic. SOL and NAEP data tell us that there is a historically high number of students entering middle schools across the Commonwealth without adequate reading skills. Our middle schools do not currently have the resources they need to teach these students how to read. SB 1175 responds to this crisis. It will ensure that students in grades 6 through 8 have access to the evidence-based reading instruction they need to become proficient readers. It will support our middle schools to provide this instruction with additional reading specialists, regional literacy coaches, and professional development for teachers and principals. In short, SB 1175 provides for much-needed research-based reforms that will ensure Virginia students enter high school with the reading skills they need to be successful. For these reasons, I urge you to pass 1175. Thank you.
Do you have anyone else, Madam Chairman?
Yes,
who wants
I do.
to speak on the bill? Okay.
Tom Smith, the Superintendent's Association. We're in strong support of this bill, and we appreciate the patron bringing it. Reading, if you cannot read by the time you get to middle school, it's disastrous, to be very frank with you. So we would ask you to pass the bill, please.
Thank you.
Thank you.
Good morning, Christian Martinez from CASA, the advocacy specialist. We thank the patron for bringing this up. It's very important to improve our literacy. We passed this unanimously last year, so we ask for you to pass this unanimously again for this year. Thank you.
Thank you.
Good morning, Mr. Chair, members of the committee. Emily Webb with the Virginia Chamber of Commerce. As you've already heard from our other speakers, the importance of literacy instruction and reading on grade level. We believe that this is ultimately a workforce bill that will strengthen our talent pipeline, and we are in support of it.
Thank you. Next.
Good morning, Chad Stewart with the Virginia Education Association. We strongly support this bill, particularly the element of additional reading specialists in grades 4 and 5. We believe this is the strongest aspect of this bill for improving educational outcomes in elementary school. Thank you.
Thank you.
Good morning. I'm Trolin Seward with the Virginia Literacy Association. We are in strong support of the Virginia Literacy Act. While the pandemic has indeed exacerbated our reading issues, they were there prior to the pandemic. And we are in desperate need of having these reading specialists get in the 4th and 5th grade and in middle school to get our students where they need to be. And I will say, I don't think I've been here for 20 years working for reading specialists, and I think we're finally there. I said I was going to stay and not retire. Now I can retire. Thank you.
Thank you. Next.
Good morning, Bev Lammy, Henrico Schools. I just want to echo the comments that have already been made, but I think the key, as we said, to this bill is the staffing that is there to help these children. Interestingly enough, I heard this from one of our sort of new teachers, and she said, I just finished my preparation for teaching and was really not well-versed in how to teach reading. This is a middle school teacher, so I'm very, very pleased about a lot of the work that's going on with this bill. Thank you so much, Senator, for carrying.
Thank you. I would assume that there's no one out there in favor of illiteracy and opposed to this bill. You want to wrap it? You want
Yes,
to conclude on this?
yes, well, without the presentation and the support of all of those who've come after me, Mr. Chairman, I'd recommend that the bill be reported.
Right.
And of course, it has been requested by Senate Finance.
Is there a second? Second. It's been properly moved and seconded that the bill be reported and referred to Senate Finance. All those in favor of reporting 1175 and referring it to Senate Finance, vote aye.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported and referred to Senate Finance. Senator Lucas, you have 1211.
Yes, sir, I do. Thank you so much. Mr. Chairman, members of the committee, the Eastern Virginia Medical School establishment of Eastern Virginia Medical Science Center at Old Dominion University. What it does, it repeals provisions establishing and relating to Eastern Virginia Medical School and designates the school and division previously existing as the Eastern Virginia Medical School and such other academic units of Old Dominion University related to health sciences as may be identified by the Old Dominion University Board of Visitors as the Eastern Virginia Health Science Center at Old Dominion University. The Health Science Center, the bill permits Old Dominion University to provide medical and health science education and related research through the teaching hospital and related healthcare and health maintenance facilities at the Health Science Center and contain provisions relating to the operation of the Health Science Center, including provisions related to cooperative arrangements and joint ventures. There was a presentation earlier this morning. I don't think there needs to be any further. So with that, Mr. Chairman, members of the committee, I recommend that the bill be reported and be referred to Senate Finance.
All right, you heard the bill. It's been widely reported newspapers. All those in favor of reporting Senate Bill 1211, which starts the merger of Eastern Virginia with ODU, vote aye. Those opposed, vote nay. And referred to Senate Finance.
Correct.
Ayes 15, no zero.
Ayes 15, no zero. The bill's reported and referred to Senate Finance.
Correct.
Senator Lucas, you have 1215.
Yes, sir, I do. Thank you, Mr. Chairman and members of the committee. The competitive compensation of education, this is to invest in evidence-based approaches to improve student outcomes. And let me tell you why this matters. Effective teachers are the most important school-based determinants of student education performance. Low pay in Virginia is contributing to teacher and other school staff shortages. Higher pay attracts high-achieving young people to enter the teaching profession, and hope keeps teachers from leaving the profession. Teachers gain critical experience and skills over the first few years of their careers, and experienced teachers play a critical role as mentors for new colleagues. Shortage of teachers and support staff are creating challenges across Virginia. Statewide, unfulfilled teacher positions rose to 2,594 in 2021 through 22, up from 877 during the 2018-2019 school year. Likewise, Virginia students began the 2021-2022 school year short of instructional aid and paraprofessionals, 1,367 vacancies, 771 in special education, and bus drivers, 2,045 vacancies. The pandemic has exacerbated staff shortage and student achievement gaps that already exist. Students, especially those historically disadvantaged, will require additional support as they recover from lost learning and other impacts potentially affecting mental health and well-being. Teacher pay in Virginia is low compared to other states and professions. Virginia teachers are paid on average just 67 cents for each dollar paid to their similarly educated peers in other professions. This is the third biggest pay penalty in the country. In 2021, Virginia teachers were paid 10% less than the U.S. average, even before adjusting for Virginia's typical high wages for other professions, as salaries elsewhere grew, catching Virginia. Support staff working full-time in Virginia public schools have average earnings of just $32,755, and Virginia can do more. I have lots more that I could add to that, Mr. Chairman, but with that, I would like to recommend that the bill be reported and referred to Senate Finance.
Okay, so,
Mr. Chair, we have a speaker on Zoom.
Yes.
okay.
Hello, thank you, Chair and fellow senators. I'm Victor Monti from Faber, Virginia, and Nelson County. An honor to be here with you. I support Bill 1215 to improve student outcomes. I know Virginia, been here quite a while, is a high-tech state. We have the top global IT companies, sophisticated defense industries. We have leading higher level of learning institutions. But public school teachers are paid so low that we're near the bottom when it compares to other states in terms of rankings of teacher salaries. And of course, hiring is made difficult that way. So we end up having creating two tiers of schools: those for the rich, the private schools, the academies and parochial schools, and then the public schools, which are here to serve everyone, all students, for the public good. So we need to have properly paid teachers to serve the public good in Virginia, an esteemed state. So I ask that you all support the Bill 1215 to get the teachers, the great teachers that this state deserves, and to eventually improve student outcomes. Thank you.
Thank you, Mr. Monti. All right, is there anyone else that desires to speak quickly on this bill in support of?
Thank you. Thank you, Mr. Chairman. Shane Riddle with the Virginia Education Association, representing close to about 45,000 teachers across the Commonwealth. As Senator Lucas made a lot of the points, I just want to reiterate that this issue with teacher pay, when we survey teachers, the number one top reason for them not wanting to go into the profession or even stay in the profession is pay. The pay penalty here in Virginia is about 32% to comparable professions. And we really need to fix this problem to make sure that we can not only retain, but get students to go into the teaching profession and stay there. And state policymakers must protect and enhance the ability also of local governments to help with this. And so we not only strongly support this bill, but also strongly support lifting the support cap so that this can help locals match the state portion of what's given. We have made progress in this area. We just need to continue down this path to continue that progress to get our teachers at least to the national average or over and above that. Thank you so much, Mr. Chairman.
Next.
Thank you, Jane.
Yeah.
Thank you.
Tom Smith, Superintendent's Association. I'm not sure I can add much more than what the patron and Mr. Riddle have said. So just to let you know that we're in strong support.
Appreciate that. Thank you. Next.
Hi, I'm Maggie Hansford. I'm from Prince William. Speech pathologist by trade. I have 3 children in our public schools. This morning, Prince William County, we have over 700 openings right now. And what that looks like for our staff is that they have a heavy, heavy lift to ensure our children are learning a full years of growth every year. And so what I ask you all is to understand a budget is a bonus is wonderful, but it doesn't help pay the bills all year long. We need not a livable wage, but a thriving wage. We need to be able to live where we work. It's very important to have our educators living in the community where we work. We have educators commuting from here to Prince William. So please, I thank you, Senator Lucas, for putting this bill to the floor. So please support this and please help our educators ensure that our children are learning to their largest potential. Thank you.
Thank you.
Next.
Good Good morning, committee. My name is Vernon Peters. I'm representing Virginia Professional Educators and Independent Teachers Associations of the Commonwealth. And of course, yes, we strongly support the bill. But just to give you an example, speaking to some of our members this year, they left the profession to become truck drivers and double their salary. That's where we're losing teachers. Thank you. Thank you.
Good morning. My name is Laura Gorn. I'm with the Commonwealth Institute. And for the reasons previously stated, we and our partners in the Fund Our Schools Coalition strongly support this bill. Thank you.
Thank you. Next.
Good morning, Stacey Haney with the Virginia School Boards Association. We're also in strong support of this bill.
Thank you. All right, wrap it up.
Yes, Mr. Chairman, as I indicated earlier, the state is providing its portion of the 5% salary increase this year and next, but this won't be enough to reach the national teacher pay average and may not even keep up with inflation. So with that, I'd like to reiterate my motion to have the bill be passed and re-referred to Senate Finance.
Mr. Chairman.
Senator Cosgrove.
Thank you. Senator Lucas, what kind of financial impact is this going to have on localities trying to match these elevated salaries?
I think we'll figure that out when it gets to Senate Finance. Senate Finance Chair will help us, and Finance will help us with that answer.
Mr. Chairman. Well, then I would ask you, Senator Lucas, to make sure that basically if the state wants to do this, and I think it's a justifiable cause, but if the state wants to do this, the state needs to put the money in to make it happen.
I don't disagree with you. I came from local government just like you did, and you know what the schools say to us, and we send mandates to them, so we'll work it out.
All right, thank you.
I think there's some money in a pot that's called tax relief.
I was just saying, you can't do all these things that are desperately needed and give tax cuts of which nobody's requested other than the current administration. Okay. I haven't gotten a single email. All right. Is there a motion?
I made the motion, Senator.
To report and
Report and refer to Finance.
All
Yes.
those in favor vote aye. Those opposed, nay.
Ayes 15, no 0.
Thank you, Mr. Chairman.
Ayes 15, yeas nero. The bill is reported and referred to Senate Finance, and I believe that wraps up the calendar. Senator Lucas, okay, there's no other business. The meeting is adjourned.